Important wound care tips for diabetic people. There was a time when a minor cut only needed a quick wash and a bandage, and a mother's magical healing kiss if you were a youngster. But if you have diabetes, a wound, cut or skin abrasion requires much more care and monitoring. Here are some important wound care tips for people with diabetes. Number 1. Clean and check the wound. Before you start any kind of treatment, clean the affected area thoroughly. Proper cleaning of a wound will ensure optimal healing and reduce the risk of infection. Number 2. Manage blood sugar level. To reduce the risk of infection from minor wounds and cuts, it's also important to keep a close eye on your blood sugar level. High levels of glucose in the blood can delay the healing process and even increase the risk of infection. Number 3. Honey. Honey can be used to treat wounds in diabetic people. Clean the affected area with plain water to remove dirt and germs. Rub honey on a wound dressing and carefully wrap it around the affected area. Change the bandage 3 or 4 times a day. Number 4. Aloe Vera. You can use aloe vera to treat wounds in diabetic people. Cut open an aloe vera leaf and extract the gel. Apply this gel on the wound and allow it to dry on its own. Clean the area with warm water and pat it dry with a soft towel. Repeat several times a day until the wound heals completely. Number 5. Turmeric. Turmeric is a natural antiseptic and antibiotic agent that can be used to heal minor wounds and prevent infection among diabetic people. If a minor wound, cut or abrasion is bleeding, apply some pure and organic turmeric powder directly on the affected area to help stop the bleeding. If you liked the video, give us a thumb and subscribe to our channel. Thanks for watching and please share with friends.